Welcome, welcome everyone to tonight's presentation, Thriving with Diabetes. Happy to have you here. Thanks everyone for joining. I'm going to turn things over now to our Executive Director, Ellen Kissick, who's going to make some introductions of our panel. Ellen, as far as I'm aware, we have 2 out of our 3 panelists that have joined us so far. I may be wrong, but if you could introduce Dr. Bindlish and Dr. Wu. They have quite a bit of material to present tonight, and we can get started.
Great. No, thank you, Tom, and thank you everybody for joining here today and hearing from our distinguished panel of experts in diabetes. Before we get started, I also want to recognize Danny Medley as well. Danny is our Associate Director of the Silicon Valley Tour de Cure. So he's joining us as well. And I think most of you know Tom Hall, who is our Wine Country Tour de Cure. So it is my honor and my privilege today to introduce our diabetes experts. This event is a stop on the roadmap to the Tour de Cure, so really excited about the content of today's presentation, which is ultimately designed to help people with diabetes thrive during this really challenging time that we're in at the moment. So first and foremost, you'll hear from Dr. Bindlish from One Medical. Dr. Bindlish is a diabetologist by training, and as I mentioned, practices at One Medical. I'll send over a link to her profile at One Medical shortly so that you all can access her if you want to get in touch with her. We will also, you also hear from Dr. Francisco Prieto, who hasn't joined yet, but hopefully he will join us in a few moments. Dr. Prieto is a family physician with a very long-standing practice and experience with treating people with diabetes. He's also a patient advocate and has been very instrumental in advocacy in Sacramento for a very long time. He also used to sit on our board of directors there. And last but not least, Dr. Wu. Dr. Wu is an endocrinologist by training and practices at Steady Health. So you'll be hearing Dr. Wu as well. And I should mention that Dr. Bindlish and Dr. Wu are both board members, community board members at the American Diabetes Association. And Steady Health is a sponsor of the Wine Country Tour de Cure. We also have Sutter Health sponsoring the event this year, the Santa Rosa division of Sutter Health. So thank you to our sponsors for making this all possible. So our first panelist is Dr. Bindlish. I believe the slides are all ready for you, and I'm glad that you're here. So I will now hand it over to you. Oh, sorry, you could skip through slides.
Excuse me, Danny. Dr. Bindlish has 4 slides that are a little bit further on in the presentation.
And if you're curious about how to spell Dr. Bindlish's name, here it is.
Thank you very much, Alan and Tom, for giving me this opportunity to be part of Tour de Cure and also being here today to share some of our knowledge and best practices to treat diabetes. And I really hope some of these tips are going to be helpful for everyone and day-to-day life. So one of the very common questions that comes up is like, why is COVID-19 so devastating to patients with diabetes? And I think this is one of the very common questions, since we are facing this COVID-19 era since, I think, February, since it has started. So I would like to talk about it first. So living with diabetes can be very stressful during the COVID-19 pandemic era when we think about dealing with double pandemic situation. However, there is not enough data to show whether people with diabetes are more likely to get COVID-19 than the general population. So that's why if you see this in this slide, the first point is diagnosis of diabetes does not independently mean increased risk of severity in normal healthy person. The problem people with diabetes face is of the worst outcome in case they get sick with virus, especially if someone has uncontrolled diabetes and they're taking high dose of insulin. There is also a possibility of increased risk of severity with COVID-19 when there is blood sugar fluctuations like high blood sugar or the low blood sugar, old age and other comorbidities like heart disease, high blood pressure. All of these also independently contribute to this. And generally, we believe that more of the health conditions patient can have, for example, diabetes and heart disease, a combination of that, higher their chance of getting serious complication of COVID-19. So why is this more important now that we really focus on achieving better glycemic control? So at present, the situation is quite different than normal, as we all know. People with diabetes are already dealing with a lot of different type of stressors in day-to-day life when there is no COVID-19. If we really think about the life of a patient with diabetes, they have to go through a lot of changes, a lot of adjustments in their schedule in day-to-day life. And that's what we say that we use a term for that. It's called like diabetes distress. So during this period, there are multiple psychological and social factors that are contributing here since we are facing this pandemic situation. Just a second. So for the stressful situations, like if you think about having factors like so multiple psychological factors that are contributing to this situation, and we all are trying to just get rid of it because of during the COVID-19 time. So more when you really think about what is the best practice for patients with diabetes, is that think about your dad. Think about dad in a way that DADD. So if you think this is the major thing, diabetes, this is my mnemonic which I have created to make my patients understand what is diabetes. So we all are aware about the diet. We always think about the activity, but we don't think about the diary so much. So what is the diary? Diary is about taking care of your blood glucose, like monitoring your blood sugar in day to day. And it has become so important right now because at this time, you have to not panic. You have to be prepared for the sick day, how you will manage your sick day. Then in diary, it also mentions about what do you do for your day-to-day eating, especially in this COVID situation when you're at home, how you're going to manage your diet. Some of the patients really did very well because they were getting more time being at home in planning. So maintaining the diary is very important. And also the activity, so keeping track of your activity, it doesn't matter, you use the app or you use it, but to do it by yourself at home, anything is fine. But do put the focus on diary as well. And then only when you do all of these three things, then the drugs will help. And in this time, it's also important to make sure that the medications that you're taking, you do not stop. Even if you're sick, then you should definitely consult your physician whether you should be taking this. If you have to adjust your medicine, take it more or less. But when you do all of these three things, that the drugs definitely works better. Next slide. So in my last pointer, I have a very common phrase, which is called ABCs of diabetes. So think about your A1C, think about your blood pressure control, and think about your cholesterol management. I think at this point of time, during this time, every 3 months checking is very important. Keeping a track of it just to be sure that your blood pressure, your A1C, and your cholesterol is under control. And stop smoking. If you have that habit, discuss with your doctor of various options. because this is the time when you want to make the changes to have an optimal glycemic control. Thank you.
Thank you, Dr. Bindlish. We're going to entertain questions at the end. I just want to check to see if Dr. Prieto has joined us. I'm not seeing his icon here on the participant list. So in that case, we will turn it over to Dr. Wu, who I think has some comments, tips, advice that will complement your presentation, Dr. Bindlish. So we'll turn it over to Calvin.
Yeah, good evening, everyone. Yeah, so as Alan mentioned, I'm an endocrinologist based in San Francisco, and I'm proud to be part of a team effort at Steady Health to advocate for a better care model that aligns the needs that better aligns the needs of people with diabetes. For those of you who are unfamiliar with Steady, we are in short a full-service diabetes clinic available on your smartphone, and we're using technology in the form of continuous glucose monitoring, telemedicine, and software to create a more continuous, more personal, and more data-driven diabetes care experience. On the topic of thriving with diabetes, first of all, I want to echo that I completely agree with Dr. Bindlish's points and so forth, that, you know, and all of her points, really. And I'm hoping to maybe address a different aspect of this, this pandemic and thriving during this time. I certainly want to recognize that the pandemic has been difficult for all of us. Many of us are scared to venture out, and that's true for people with or without diabetes. That said, I just want to reinforce the public health efforts. That's good hand washing, mask wearing, social distancing, and self-quarantine when sick, because they work and will help us get us out of this crisis as we wait for progress towards a vaccine. With our time at home, I just want to remind everyone that we should really try to devote more time to ourselves, to self-care and the things that we enjoy, doing our best to be kind to ourselves and our loved ones, because these are challenging times. On the note of the kind of technology, though, and so forth, you know, having diabetes is never exciting, I'll say, but I will say that it is a very exciting time in regards to breakthroughs and advancements in the field. And there are actually a number of tools that make caring for diabetes easier and more effective during this time. So, I mean, for one thing, given that so much of diabetes is numbers-based, it really lends itself to telemedicine and remote care. So we're seeing a lot of that happen. There's smart pens out there. There's one currently, for instance, Yen Pen, and there's several more in development. But you know, I think the most important tool that comes to the fore here is really continuous glucose monitoring. For those of you who don't know what CGM is, these are wearables that you can put on for 1 to 2 weeks at a time. They measure blood glucose every 5 to 15 minutes. So in a day, you'll have nearly 100 to 300 readings compared to the 1 to 4 you might typically get with finger sticks. And that's great, because it gives you almost real-time knowledge of what your glucose levels, how your glucose levels respond to meals, medication, and lifestyle. And that alone can drive a lot of positive behavioral change and more informed decision-making. These devices have been shown to reduce the risk for hypoglycemia and provide a much more immediate feedback on glucose control than an A1C every 2 to 3 months. Most notably, it allows for time and range, which is just a much more relevant metric day to day. You know, that is trying to keep blood sugars between 70 to 180 as much as possible, really aligns with what makes most people with diabetes good. Many of us in our field agree that CGM should be more widely available. And for that, if anyone's curious about it, by the way, and hasn't had an opportunity to try it, I encourage you to consider our $50 5-week starter program, actually, that we just started at Steady. That includes a prescription for 2 sensors, a live training, an opportunity to track meals and exercise through our app, and learn about your glucose patterns through 2 reports and a live CGM interpretation session. But yeah, on going back to that note of, you know, this is just being exciting times, you know, in just this past year, we've had now 2 advanced automated insulin delivery systems, newer, faster insulins, glucagon available as a nasal spray and prefilled syringe, more evidence of type 2 medications having benefits outside of just glucose control in heart failure and kidney protection, for instance. And that's just the tip of the iceberg.
Weird, isn't it? I guess
Sorry? Can you hear me?
Yes, yes, we can.
Okay, cool. Just that there's actually as many as 40 CGMs in development right now. There's the promise of actually more high glucose devices that actually will assist glucose prediction, dose recommendation. So again, there's a lot of tools out there now and that are coming down the pipeline. So highly encourage you to speak to your providers about these and using these to your advantage.
Great. Thank you, Dr. Wu.